A wise man never knows all, only fool knows everything. I have written in my room and behind wall it is written that no one is complete in any aspect of the knowledge and never hesitate to say that I am ignorant. So knowledge gaining is a continuous process. One should never say to stop getting the knowledge. So the next parameter is role of the iron. Once bacteria penetrate surface of the body, they are in an environment without free iron, which is very essential for the bacterial growth. Bacteria require iron for metabolism and growth, and the requirement is 0.4 to 4 micromole per liter. Bacteria search free iron in the host, but which is very low in host tissue and the blood because all the iron in the host is in the bound form as plasma, transferrin, or hemoglobin in the erythrocytes. Now, without free iron, bacteria produce iron binding molecules or the factors called siderophores or the receptor for the iron containing molecules. These are called siderophores. These compete with the host for the iron bound to the hemoglobin, transferrin, and the lactoferrin, whatever the iron is available in the host tissue. Binding power of the siderophore for iron are very high. They can snatch iron bound to the transferrin and lactoferrin from the host tissues and present it to the bacteria, which enables them to grow to the bacteria. Here one can see the bacteria, and here is the receptor for the bacteria, and here is the siderophore that bacteria is being produced, and this siderophore is attached to the receptor, and they are capable of snatching or getting the iron from the body or from and providing it to the bacteria. Similarly, this is called iron thievery. The iron is just being taken from the different tissues of the host cell, and here one can see the siderophores. They are getting the iron from the body, and the different molecules lipocalin, lactoferrin, transferrin, and ferritin from all these which contain iron, as one can see the small round balls, and siderophore, the large ball, they are capable of snatching this iron from the body tissue, which is found in the host in the different form as transferrin, lactoferrin, or lipocalin. The type of the bacterial siderophores are enterocalin, enterobactin, catechols, phenolates. These are produced by the Escherichia and the Salmonella species. The Salmonella mutants unable to synthesize enterocolin, and if they are not able to synthesize, they lose their virulence. If we put the injection of the purified enterocalin to these mutants, they restore their virulence and they are capable of infecting again. So siderophores production by pathogenic bacteria is an important virulence mechanism. I have already told it in my lecture on the bacterial virulence factors. For detail, one can have that lecture also. Similarly, iron in milk and other secretions like tears, saliva, bronchial mucus, bile, and gastrointestinal fluid is bound to the lactoferrin. Some bacteria have the receptor for iron binding proteins like transferrin. These bacteria are the Neisseria species. They can get the iron from the transferrin. And here one can see the gram-negative bacteria. They have got the different molecules which are capable of snatching the iron These are enterobactin, salmocalin, citrocalin, enterobactin again. Similarly, in gram-positive bacteria, these staphylococcus A, these staphylococcus B, as one can see these, and they are capable of snatching the ferric iron and providing to the bacteria for their survival. Similarly, the fungal pathogens can also use the iron by having their different iron snatching molecules. These are fusarenine and the TAFC and ferricrosins. These are all the molecules capable of having the iron from the host tissue or from the other sources. Now, the next parameter is innate immunity, that is called also inborn or the natural immunity or the non-specific resistance, which is produced at the time of the birth in a person. So that is called inborn or natural immunity. It is second line of defense and consists of genetically encoded molecules present in the body from birth that can recognize microbial features common in many pathogens and foreign substances. It gives early warning against these bacteria or even our own cells when they become damaged or the cancerous. So this immunity is capable of telling that bacteria or some cells which are not normal, they are also responsible for causing damage to the body. This defense system responds within minutes or a few hours after infection. And here one can see the epithelial barriers, innate immunity, phagocytes, and plasma proteins, complement, etc., and dendritic cells and natural killer cells. These start acting from within few hours, 0 to 6 hours, and these do act in 12 hours. So that is innate or inborn immunity. Innate immunity consists of phagocytic WBC macrophages causing phagocytosis in the early stage, then antimicrobial protein like complement and interferon, which are also capable of killing the pathogens, inflammatory response via cytokines. These are also causing the damage to the bacteria. So the first is phagocytosis. Bacteria invading tissues are recognized as the foreign by the phagocytic cells of the host. These cells patrol blood and tissues, and these are always present there just to safeguard the tissue. When organisms enter body via mucous membrane, they are taken up by the phagocytes, transported into the regional lymphatic vessels and to lymph nodes where these are being killed and destroyed to non-harmful things. The phagocytes act as barrier and stop further spread of the bacteria, mainly neutrophils, monocytes, macrophages, eosinophils, and fixed macrophages of the reticuloendothelial system like spleen and liver. They are also capable of killing and trapping these bacteria. Phagocytosis can occur in absence of the serum antibodies. And here one can understand what is phagocytosis. As the bacteria comes to the phagocytes, it makes a receptor or depression which just trap the bacteria to allow it to come inside, and through the receptor, when it comes inside, the phagosome within the macrophage takes up the bacteria, and this phagosome then transforms into phagolysosome because the lysosome also incorporate with the phagosome to make phagolysosome, and lysosome have the weapon, destructive weapon like bombs, cannons and other things which are being fired on the bacteria to kill the bacteria. And here one can see the bacteria just changes and tears apart into pieces, and ultimately the soluble debris through the exocytosis in the macrophage, and that is going to be expelled out. So this is the complete process of phagocytosis taken up by the bacteria, phagosome, phagolysosome, and ultimately coming out through the exostosis. And these sometime are going to just deliver these bacteria to the lymph node via the afferent lymphatic vessels, where the bacteria are, because these are the checkpost, first line checkpost, here the bacteria are killed and debris is made out through the afferent vessel. So after phagocytosis, bacterial cells are killed. When inflammation occurs, phagocytic cells plus T cells and B cells, lymphocytes also contribute. These make specific antibody to protect against the reinfection by these bacteria, because these keep the memory of these invaders, and whenever they come again, they just make specific antibody against these pathogenic bacteria or invading bacteria to kill them. During bacterial infection, number of the circulating phagocytic cells often increase. That is just the army is being asked and rush to that site where the enemy has invaded the border. Function of the phagocytic cells include migration, chemotaxis, ingestion, and microbial killing. Many microorganisms release chemotactic factors. These chemotactic factors are responsible for attracting the phagocytic cells, because these are being just reach to that chemotactic factors are responsible for attracting the phagocytic cells, which reach there and call the killing of the bacteria. Second line of defense involve white blood cells, non-specific response through macrophages that target the invading pathogens. Then specific response, that is via the lymphocytes that produce antibodies specifically that target specific pathogen. Here one can see the macrophage is capable of just killing any bacteria that is being ingested, but here one can see the bacteria has certain antigens, and these cells are capable of making certain antibodies which are going to act with these antigens, and this antigen antibody reaction is capable of killing these pathogens. So the mononuclear phagocytic cells seen in the blood, lymphoid tissue, liver, spleen, and lungs, these are also capable of causing phagocytosis. Phagocytic cells are inefficient in large, smooth, open spaces like pleura or pericardium or the joints, but they are more effective in small tissue spaces like alveoli. So here they are called surface phagocytosis. Spleen also filter microbe from the blood. It is the part of the reticuloendothelial system, and it just checks and filter the microbe. Patient after splenectomy suffer from the bacterial sepsis with pneumococci and the salmonella, because these are not being checked by the spleen. Phagocytosis is greatly enhanced by opsonins. Here one can understand the phagocytosis. The extracellular bacteria, when they come in contact with the macrophage, there is opsonization, and via the opsonization being the macrophage do ingest and take up these bacteria after the opsonization inside the macrophage, and here there is the one can see the injection by the macrophage after the opsonization, and then there is the digestion in lysosome, as I have shown you in previous slides, that lysosome, they just come into the phagosome and they cause the bombardment. They have got the weapons of the different kind to kill the bacteria, and ultimately result is digestion in lysozyme. Here is a diagram, very classical, as one can see the father have given and donated the different pieces of his body to his son, and the last piece which is deficient in the son, and the father is giving that piece also. So the father gives everything he owns to his son and feels happy. He is the only person who wants to see someone better than him and someone higher than him. Now, antimicrobial proteins, these include complement and interferons. Complement system proteins enhance the function of both adaptive and innate response to the infection. After phagocytosis, there is activation of the complement by the alternate pathway. This pathway can occur in absence of the antibody. These are important non-specific host responses. There are many antimicrobial properties of the complement like opsonization, lysis of the bacteria, and amplification of inflammatory response, say through anaphylotoxin C5a, C4a, and C3. All these are to direct the bacteria towards the macrophage or to the defense system to be killed by the defense system of the host. Next line of defense include responses like release of the cytokines from the macrophages and other mediator interleukins, eicosanoids, complement that triggers inflammatory response. This inflammatory response, though it is defensive mechanism, but that is capable of killing the bacteria. Cytokines are the small protein produced by the various defensive cells like macrophages, lymphocytes, mast cells, and dendritic cells. By sending chemical signals to the tissues, initiate the acquired immunity, the inflammatory response occurs rapidly and hold spread of the pathogen to the deeper tissue. Here one can see the inflammatory response. Wherever there is injury, there is infection by the bacteria. As one can see through the blood, the neutrophils, these come out, and these are the cytokines. These are just going to attract these neutrophils by cytokines, which are the chemotactic in nature, and from the blood these come out and responsible for killing the bacteria. The other cells which are taking part in this process of inflammatory, as one can see, these are the different cells, lymphoid, natural killer cells, and other cells. They have got the different function, and they are responsible for causing damage to the bacteria, and ultimately their aim is to kill the bacteria. The next is adaptive immunity, also called specific immunity, cell-mediated immunity. Antigen-specific antibodies are produced by B and T cells. Specific antibody produced also protect against reinfection because of the memory cell that they keep in their mind, and whenever these kind of antigen or the bacteria come again to invade, these memory cells are capable of producing those antibodies which are specific for those bacteria to kill these bacteria. These elicit humoral and cell-mediated immunity. It is of two types, active acquired immunity and the passive acquired immunity. Say, one can see adaptive immunity, long-term immunity is for against mumps, and that is the injection that is given that produce 15 years of immunity against that bacteria. Short-term immunity is the mother to the child through the serum. So acquiring immunity to infection, the passive immunity is through the injection, and the active immunity is being taken up by the person through certain processes, and that is going to have the active immunity. That is sometime by the toxide, and the passive immunity is through the serum, which already contain antibodies. The toxide is capable of making the antibodies which are going to have effect against these bacteria. The active acquired immunity, also called active immunization, a protection based on the exposure to the organism as overt disease, subclinical infection like infection without symptom or after a vaccine. This protection has a slower onset but longer duration than passive immunity that I have told you the example of tetanus toxoid. The primary response takes 7 to 10 days for antibody to become detectable. Advantage is that an amnestic secondary response occurs whenever these kind of the bacteria comes, they are being killed. A rapid response, 3-day occurs with large amount of the antibody to an antigen. So here one can see the active immunity is through the injection and that is capable of producing the antibodies. So that is the vaccination which are responsible for causing active immunity. Similarly, artificially acquired active immunity is the through the vaccine to body, ask the body to produce the antibodies. The active acquired immunity is mediated by both antibodies, Ig and T cells. These antibodies protect against organism by neutralization the toxin which the bacteria do have, lysis of the bacteria in the presence of the complement, opsonization of the bacteria to facilitate phagocytosis and entering the bacteria into the macrophage to be killed by the process of the phagocytosis and block adherence of the microbe. If level of the Ig drops below 400 milligram per deciliter, normal is 1000 to 15,000, there is risk of pyogenic infection. Antibodies IgG appear late, have no role to combat primary infection at initial site of infection. It is IgM which takes part. So active immunity, one can see the vaccine, the antigens are being injected and these antigens are capable of eliciting and producing the antibodies. Immunity given by the antibodies made by the immune system is a response to an antigen, and here this is the process of active immunity. The antigen injected, then it makes the antibody. So antigen produces the antibody when it goes into the blood. Active acquired immunity but protect hematogenic spread of the organism to distant sites and against a second infection by the same organism. I have told you already. T cells causes cytotoxic destruction of the bacteria, activation of the macrophages and delayed hypersensitivity. T cells also help B cells to produce antibody against many antigens. Essential host defense mechanism against bacteria are humoral immunity against pyogenic bacteria and exotoxins and cell-mediated immunity against several intracellular bacteria. So the passive acquired immunity, also called passive immunization, a temporary protection against an organism by receiving serum containing preformed antibodies from a human or the animal against that organism. I have given you the example of the tetanus. If you want the immediate protection, give the tetanus serum rather than toxoid. It occurs as immunoglobulin passed through placenta, IgG, or breast milk from mother to child. So that is passive ready-made immunity, very important in early life when child cannot has an active response. And advantage is that protective abilities are available immediately. Here one can see the passive immunity by the breastfeeding from the mother to the child, conferred to the child from mother through breast milk. Similarly, maternal antibodies that can also go to the child, and the artificially monoclonal antibodies that can be given through a drip to a person who is seriously ill, and these antibodies are capable of combating the infection. Disadvantage is that antibody concentration decreases rapidly as proteins are degraded. But in case of the active, the antibodies level increase day by day. So protection lasts for short duration. Giving preformed antibodies is life-saving in diseases like botulism and tetanus due to powerful exotoxin to be neutralized by these antibodies. Serum globulins are given prophylactically in bone marrow transplant hepatitis A virus. They have little effect on bacterial disease, and here one can see the active and the passive, natural, and here natural acquired through the injection and acquired through the serum, the immunoglobulin. That's it. So the immune system, we just have the summary: innate of the natural immunity, non-specific response. First line, skin, mucous membrane, and normal flora. Second line, innate immune cells, inflammation, complement, and antimicrobial receptor. Adaptive or acquired immunity specific responses are the third line response that comes after second line. These are the specialized lymphocytes, B cells, and T cells capable of producing the antibodies, or also the helper T cells and the killer T cells also produce the specific antibodies against specific antigen. So the innate immunity, rapid response to a broad range of microbes and invading microbes, pathogen, acquired immunity, slow response to the specific microbe, and external defenses like skin, mucous membrane, secretions, and the chemical weapons, internal defenses, phagocytic cells, antimicrobial proteins, inflammatory response of the body, natural killer cells, humoral response, antibodies being produced against the antigen, cell-mediated response, cytotoxic lymphocytes. So that is all about the host defense against bacteria. I hope you have liked that lecture. If you have liked that lecture, please subscribe it and share it to the others. If you have any question, please ask me. And thank you very much for having my lecture, giving the time.